A cut. Now patients will say they have cut their hand, they've cut their foot, they've cut their leg. And then very often they will describe it by how it happened. They sliced it, they chopped it, they tore it, or it was torn. Now in medical English terminology, we describe cuts as lacerations or incisions. Now a laceration is a cut that the patient comes to the hospital with. Okay, so it's a cut made outside of the hospital. When a doctor or a nurse cuts into a patient in an operation or a procedure, we call it an incision. So a laceration is what happened outside of the hospital, and incision is what we do to the patient. Another important word to remember in regard to cuts, lacerations, incisions, is penetrating. How deep is the cut? How deep is the laceration? How deep is the incision? Okay, bruise. A bruise in medical English terms is called a hematoma. A hematoma. Hema. He. Blood. Toma. Swelling. This is the joining verb. So it means when you have been hit or you hit something and you get a bruise, like this guy has a bruise around his eye, it means the blood around the eye that was there at the time has now swollen or been destroyed. And this is what will cause the brown, then purple bruise. Patients will often describe it just simply as a bruise or a lump or a bump. Now we're going to talk about this more in class because bruises can be inside and outside the body. So we're going to talk about that more later. Burns. Again, patients will normally describe burns as to how it feels. A scalding burn. The burn is throbbing, it's stinging, it's radiating, it's itchy, it tingles. Now many of these things will again be dependent on how the burn happened, what caused the burn. And in medical things, we're interested in what are called degrees. First, second, third. Whether the burn is a chemical burn, a thermal burn, a radiation burn. And again, we will talk about this more in class. You just need to remember these different descriptors. Broken bones. And as you can see, this guy's broken a lot of bones, right? Now in medical English, broken bones and bone-related injuries, or major bone-related injuries, or most common, are called fractures. The fracture is when you actually break it, snap the bone. Dislocation is when the bone is out of place from where it should be. It might not be broken, but it's not where it should be. And we'll talk about that again more in class. But descriptions the patients will use: I've snapped a bone, I have chipped a bone, my arm is out of shape, I can't move it, I have reduced or lack of movement. All these things we're going to look at more in class, because it's very, very common, and we need to look at that in more detail. Infection. Infection, of course, is a very, very common problem. All right? And patients will describe infection in many, many different ways. But some of the common ones: I feel out of sorts, I feel lethargic, I feel wasted, I have a fever, I have pain, I have a rash, spots, irritation, rash, spots, irritation. So patients will normally describe their infection, like most other things, in how they feel. Okay, so we're going to take a break here, and there's going to be a few quizzes to follow all these things. And then in class next week, we're going to do some written reading and talking exercises that are based on what we have done here. So make sure you have watched all these videos and taken all these quizzes.